I'm Don Fry, President and CEO of the Greater Baltimore Committee, and welcome to GBC Insider, a program designed to hear from leaders in the private sector, elected officials, and members of the media to gain insights on key issues in business and government. Today, GBC Insider is joined by Dr. Letitia Dzirasa, Commissioner of Health for the City of Baltimore. Dr. Dzirasa, thank you for joining us.
Thank you so much, Don, for inviting me.
Governor Larry Hogan declared a state of emergency on January 4 in response to the surge in COVID-19 cases statewide, including providing assistance to the overburdened healthcare system. Can you tell us if the Baltimore Health Department is taking or plans to take any additional action to help address the rise in cases and the burden on the city's hospitals and healthcare providers?
Yeah, well, I'm happy to say that we have a really great partnership with our hospitals across the city and have been meeting with them regularly to understand their needs and what additional support they might need, especially during this time of surge. And so during those calls, we're able to help with coordination. And so we have a regular coordination call to understand, okay, how do we make sure that there's throughput and flow between facilities, again, to help alleviate some of the burdens that hospitals are experiencing. Additionally, the mayor announced yesterday that we have procured additional tests. So we went ahead and purchased additional rapid at-home tests to be distributed to city residents, either with low or poor access to testing resources. We are also standing up additional testing sites in partnership with Councilman Schleifer and Rabbi Tindler of the AccuReference Testing Group. We stood up a testing site just last week that was where the mayor spoke from yesterday. And so that site is seeing upwards of more than 1,000 individuals per session.
So it's been stated that Maryland is facing a terrible point in the pandemic over the next 4 to 6 weeks. What key guidance are you providing to citizens to help get the current surge under control? And what specific steps can business take to help mitigate the cases?
Sure. I cannot stress enough the importance of vaccination. We've been talking about it for really more than a year now. But what we know about this particular variant and what we're seeing now is that vaccinations do help mitigate the severity of disease, right? And so just being vaccinated doesn't mean you won't get Omicron. It doesn't make you, insusceptible to getting it, but it does significantly decrease your chances of severe outcomes, death, or hospitalization. And again, we're really thinking about how this could potentially overwhelm our healthcare system and prevent them from being able to provide other acute care, not just COVID-related care. So I would stress the importance of vaccination. I would stress the importance of the other mitigation measures we can all take, right? And so avoiding large crowds or large gatherings, wearing your face mask when indoors. Baltimore City still has an indoor mask order. That's critical. We know that masking really decreases disease transmission. And so wearing that mask, maintaining that social distance, if you're not feeling well, stay home, right? And so, ideally you have access to a test and can identify disease early so that you can isolate appropriately. But even if you don't, I think you should still stay home until you can get that access and understand exactly what might be causing your symptoms.
Yeah. I assume that those recommendations are identical for business protocols as well.
Absolutely. I mean, I think, employers have a hard job, right? Because you're responsible for serving your patrons, but also keeping your employees safe. And so again, those same practices, really encouraging, some of your workers who may not be feeling well to stay home, allowing them that sick leave, that additional support, again, if it's access to testing, encouraging them to go ahead and get tested, giving them that time potentially to get tested or to get a vaccination. So that they don't feel like, oh, I can't take the time off work to do that.
So Dr. Dzirasa, thank you for your insights on two very significant public health challenges in our city and state. Your dedication to fighting these ongoing crises during this time is commendable, and we thank you for your service.
Great. Thank you for having me.
The GBC will continue to provide our members with more informative interviews with key insiders in the business and political community. Until the next edition of GBC Insider, I'm Don Fry, urging you to be safe, stay healthy, get vaccinated, get boosted, and remain positive. Thank you for joining us.